Osteoporosis develops quietly over many years, so it's important to know whether you're at risk. And it's also important to know the subtle signs of the condition. Dr. Carrie Peterson is here with more on both.
There are a number of different factors that can put you at a higher risk of developing osteoporosis. Some of these risk factors you can control, and others you can't. So let's start with those that you cannot control. These include gender. Women are more likely to develop the condition. This is because we have smaller bones to begin with, and after menopause, hormone changes can speed the loss of bone mass. A decrease in hormones, however, doesn't just affect women, but also men. For women, the loss of estrogen is the concern, but in men, low estrogen and low testosterone is a risk factor for osteoporosis. Next is age. As we all get older, we will all lose some bone mass. This goes for men and women. Ethnicity also plays a role. Women who are Caucasian or Asian are at a higher risk because their bones are not as dense as other ethnic groups. Family history and genes can also be factors, since the condition tends to run in families. And finally, people who have had fractures in the past are at a higher risk of breaking bones again in the future. While you can't change any of these risk factors, there are some you can control. These include your diet. A lack of calcium and vitamin D in your diet can increase your risk. Since bones are made from calcium and other minerals, it's important that you get enough through the food you eat, and if you don't, take a vitamin supplement. Next is physical activity. Long periods of inactivity can actually increase your risk of osteoporosis, so staying fit is important. Bones are like muscle, becoming stronger with exercise, especially weight-bearing exercises like walking, hiking, or even dancing. Drinking too much alcohol and smoking can affect bone mass. Did you know that smokers absorb less calcium from the food they eat? And women who smoke have lower levels of estrogen. We know that healthy bones need proper hormone levels in the body. Some diseases also increase your risk for osteoporosis, including celiac disease, previous or current hyperthyroidism, and inflammatory bowel disease. Finally, some medications can decrease your bone density and lead to osteoporosis. These include steroids for asthma and arthritis, anti-seizure drugs, thyroid hormones, heparin to treat blood clotting, and even some cancer medications. If any of these risk factors apply to you, get screened. Osteoporosis develops slowly and most of the time without any symptoms. But as it progresses, you may feel some of the following. Back pain. This can be severe if you have fractured or collapsed vertebrae, which are the bones in your spine. Shrinking. If you're losing height over time or if you're starting to stoop over, talk to your doctor. Finally, if you experience any fractures of the wrists, vertebrae, hips, or other bones, it may be because of osteoporosis.
Regular screenings will help you and your doctor monitor bone mass and diagnose osteopenia or osteoporosis early.